welcome in. Welcome in. Hello, hello, hello. Let me go ahead and make sure that IG is set up. No, thank you. Hey, CD Lovely, how are you? How are you? Good to see you. Tap the screen, share the live. My green screen is not working for some weird reason. Yeah, my green screen for some reason is not working. Let me see. Welcome in, welcome in. Tap the screen, share the live. Tap the screen, share the live. Thank you guys for coming in. We're going to get started in just a couple minutes. I'm just sharing the live out to some people. Perfecto. All right. Hey, Wireless. Good to see you. For some reason, my green screen is not working today, so you'll be able to see it on, thanks, Daphne. You'll be able to see it on the YouTube, but for some reason, it's just not working. Thank you for the heart, me. My hair's looking crazy. I'm super tired. But we're here. Yay. So today, just like last week, I'm going to do Wednesday's class today and then Saturday's class tomorrow. So this is our final week of Intro to Holistic Medicine 2. And this week, I really wanted to focus on what it takes to become a provider. And then, and that's what we'll focus on today. And then tomorrow, I want to focus on what it takes to be a patient, because I don't think that those conversations are had enough. And especially in the day and age that we're in, where everybody wants to be an expert. Everybody's an expert of everything. You know, depending on the news cycle, everybody can do everybody's job. But I want to go over kind of some specific things that you really need to know if you are wanting to take this seriously and be a holistic provider. Myself, if you're new to my channel, welcome. My name is Dr. Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. And I've had a successful career over 20 something years, and that's not by accident. It's really by design. And so I want to teach you kind of what has helped me to be successful in my practice and in my life as a professional, et cetera. Hey, Jay, good to see you. So we will go ahead and get started. I'm just going to be, thank you for that, me. I'm just going to be kind of talking to you guys. Hey, say thanks, Oceans, on TikTok. If you want to look at the slides, please go to YouTube. For some reason, my LinkedIn is being funky. So there's that. But we will get through it. We will work through it, all the things. So thank you guys for the roses so much. So today we're going to talk about the provider's role, right? And the provider's mindset. And so there's a distinction between doing tasks as a provider versus really embodying the identity of being a holistic provider. So, you know, people can kind of go through and do the motions of, you know, holistic medicine, but unless it comes from your soul, unless you really believe this, like 10 toes down, chest up, it's going to land flat with your patient. It's not going to really resolve, because your patient's going to get that you're not authentic with your role as a holistic provider. Like, I just want to be clear. Like, I don't just do this for like a living. Like, I know a lot of people do things for like a job and money or whatever. I do this because I love it. I have a passion for it. It's a calling. And I couldn't see myself doing anything else. I mean, I could see myself doing like different periphery things, but specifically to be a provider has just been an amazing experience over the years. I've learned so much about myself, so much about other people, and I really want to share that with you. So first things first, let's talk about ethics and integrity. So, that is one of the things why for myself, I could not be an allopathic conventional provider like an MD or that kind of thing. And I looked at it when I looked into, going into healthcare. I considered, being a medical doctor or being a DO or something like that. And I will tell you that it probably would have been easier, quite honestly. Being a holistic provider is very much the road less travel. When I started 20 years ago, people just weren't into it. People were still very much in the conditioning of the conventional healthcare model. And we're in a post colonized healthcare system, which means that if you're a Black, Brown, Indigenous person, we are not in our current healthcare state and our current healthcare system. What we're practicing is not what our ancestors practice. Back in the day, whenever that was, our ancestors worked on the land. They, cultivated with the land. They used herbs, the medicine people of the tribe, people would go to them. And, we really cut down on a lot of diseases, especially with sanitation, public health practices, et cetera, before it was even a public health thing. And now it just seems like there's just so much quick fix. Everybody's looking for a quick fix. So I've got this going on. What do I take? I've got that going on. What do I take? And people aren't really looking at the big picture. And so ethically, as a provider for myself, I could not be in a system, right, where I would be complicit. And I've gotten so much heat for this, but I'm 10 toes down on it. The conventional healthcare system, exactly, Wireless, it is the wild, wild west. The conventional healthcare system is incredibly dangerous. We have been kind of beholden to the CDC and NIH. The CDC and NIH has a lot of special interest groups and lobbying and just a lot of, in general, like a lot of conflicts of interest. And so ethically, I wanted to be able to make decisions for my patient based off of my patient's data, what they needed, what they wanted, etc., not based off of what larger conglomerate told me I had to do. And in conventional medicine, we have a thing called, standard of care and standard of practice, and it's pretty much set, and there's not a lot of deviation that can be made from that. And that's not really healthcare. Healthcare in a sense is really creative. Exactly. They're always just treating symptoms, not looking at the cause. The system is working how the system was designed, right? Which means that it is a diagnose and manage model primarily, and, a pill for every ill. And that's just the model that goes to, and it's not working. Chronic disease rates are at an all-time high. And why is that? Because our emphasis is not on our lifestyle, it's on fixing problems as they pop up. And so when we look at integrity in our practice, it's not just, again, this is not just a job, it's what you're actually doing every single day to forward even your own mission in holistic health, right? Whether that is meditation or yoga or eating healthy or drinking water, etc. You really have to practice what you're teaching people. Otherwise, you're going to be a hypocrite. Also, too, I also want to get into like non-appropriation and having cultural intelligence. So with my public health degree, I learned so much about different cultures and different backgrounds. And it took me all over the world, working with Indigenous people from all over the world. And what I learned from those experiences really was, even though a lot of Indigenous people from different groups were inviting me in, these are not my practices to then now take and go market, right? And so if they teach me things, right, it's an honor, for one, to be taught. And then I have to take that work and do the work with myself and integrate it into what I already know to be true. And then it becomes almost a part of me, rather than if, I'm just stealing something and now calling it my own and that sort of thing. So we just want to be mindful of cultural appropriation when we are going into, oh my gosh, yeah, I do. It's one of the many degrees that I have. So I have studied the healthcare system from all angles. So not only in clinical practice with my doctorate degrees, and I have 2 of those, and I did a lot of work in laboratory diagnostics and functional medicine and integrative medicine, but then I took it further and got a public health degree. So I have an MPH, and I got that specifically for legislation. So I did legislation for a while in public health and public health policy. So the same sentiments as Harris. The system is broken. The system is broken in public health. It's been broken in public health. I don't really see it changing anytime soon, especially with RFK Jr. at the helm. And so then, in clinical practice, I then took a year off. I closed my practice in 2023, took a year off, and then I got my MBA focused on, again, the healthcare system. So looking at all different angles, the business of healthcare and the business of healthcare and, what was missing. And so what I learned in my MBA and in my dissertation for my MBA was that, there's a lot of factors when it comes to public health and chronic disease. And it's really, we know access is an issue, right? Access to quality healthcare, but also at quality education, which was really important. So there's so much misinformation. We saw that during COVID, and I'm not spiting anybody. Like I was having a conversation just earlier today. There was a well-known medical doctor who, talks all about the masking and all of that, right? So wearing a mask has shown to reduce down some infections and just spreading bacteria and germs and things like that. But what's missing from the conversation is what people can do based off of their terrain to build their body up and build their immune system up. So we'll be talking more about the immune system, especially as we get into, the holiday season and that sort of thing. But it's interesting because the conventional medical model built off of germ theory, it does not look at the body as a self-healing organism. And that's why with ethics and integrity in practice, I knew better. I knew that the body does have this self-healing mechanism called homeostasis. The body's always trying to help itself heal and get well, etc. And so really tapping into that wisdom is what we should be doing instead of trying to kind of reinvent the wheel and do all of these really aggressive, invasive procedures. Now, I'm not saying that certain procedures are not, helpful and, can't contribute to an overall healthcare regimen, but we just need to understand that it's not the be all end all to the world. So really understanding your integrity and your ethics and staying within your scope of practice and your boundaries. I see a lot of people operating way outside of their scope of practice. And so one thing I will say is conventional doctors are not trained in holistic medicine. They have no training, no education, and no experience. But unfortunately, right now, they see it as a profit center. I still do see patients part-time. They see it as a profit center. And so what they do is they hang their shingle as a natural doctor because they see that the world is changing and the conventional practice is not working. And so, hey, oh my God, I haven't seen you in forever. The conventional practice is not working. And so what they do is instead they drift over into our practice, but have no education, no background, no experience. And you can tell because they use the diagnose and manage model just with natural substances. So being a holistic health provider, as you know, we've gone through these 24 weeks. We did 12 weeks in Intro to Holistic Medicine 1, and now this is the last week of Intro to Holistic Medicine 2. Hopefully you've understood by now that there's a lot more to this than just giving people supplements, right? But unfortunately, that diagnose and manage model, that pill for every ill, gets translated over. So ethically speaking, having proper training is key, which we'll talk about that. So as a healthcare practitioner of any caliber, it really is your professional responsibility to take care of yourself. I think healthcare providers are probably some of the most sickest people, unfortunately. And a lot of that has to do with the system. You're working in a broken system and you're expected to kind of hold the system up. And, when COVID happened and all that craziness, we saw a lot of the holes, not just the holes in the system, but we saw the lack of structure, education, etc. And we definitely saw a lot of corruption, especially as all the public health policies that we learned in school, they kind of threw out and did something else. And so there was so much conflicting messages, so much confusion, and that is really dangerous when it comes to treating the general public and making sure that the general public is healthy. So, making sure that you as a provider are taking care of yourself. That may mean if you're not feeling it one day, that may mean having to cancel your patients. That may look like going on vacations a couple times a year just to clear your head. That may be doing a self-care day during the week. So you really have to create a lifestyle for yourself so that you don't get burned out, because burnout is real. People come to us that are not well, and there is this sense of almost desperation because the healthcare system is so broken and because the healthcare system is not serving people properly. We have a lot of people like medical refugees that are leaving the conventional healthcare system, and they're desperate. And so a lot of times when they come to providers like us, it's almost like they are like in the desert getting water for the first time. And so they lean on you, they pull on you, they want all the things from you. And it's really important for you to set those boundaries with yourself and make sure that you do, the things that you're teaching your patients to do: water, protein, movement, sleep, etc. So make sure that you take care of yourself, especially as you are growing and evolving as a holistic provider. Because unfortunately, what happens is if you don't take care of yourself, you will burn out, right? And burnout is real, where you're constantly giving and giving and giving and feeding and feeding and feeding, and people are taking because they love to take, but you're not necessarily refilling yourself up. So really make sure that you hold that responsibility. The other thing that we want to keep in mind is the savior complex. So your role is not to save, fix, rescue anybody, right? The role of a provider, I like to use the term doctor. I am a doctor because I have degrees that establish me as that. So a doctor's role is to be a teacher, right? And whether you're a holistic health coach or whether you're a doctor or a nurse or whatever, your role in healthcare is to educate people. You're educating people, you're motivating them, you're inspiring them to live a healthy and a holistic lifestyle if you're a holistic provider. And so a lot of times in conventional medical model, it's very ego driven. Conventional doctors seem to have a chip on their shoulder. They seem to think they know everything. And I'm not saying every single one, I'm not overgeneralizing, but I would say in kind, a lot of the conventional doctors have lost their curiosity and have lost their scientific process. It's very reductionist and finite. This is the way it's going to be. This is how it is, et cetera, et cetera, et cetera. And we know that healthcare is so unique to the individual. It's very complex. There's a lot of moving parts. It's not just about, one person knowing all the things. Even with 7 degrees in my field, I still don't know all the things, right? I still am learning and commit myself to learning all day. So when I work with patients, I have to leave my ego at the door, right? I know nothing when I'm in front of a patient, right? I'm listening, right, for what they need, what they want, and what they're going through. And then I'm thinking about what, skills, what tools, what education that I can provide them that are going to help them on their journey. So instead of me rushing in, rescuing, fixing, I have all of the answers. I'm really more of a guide and a teacher. So really make sure that you check that at the door. The other thing too is, and I'm going to turn this fan off because it's like blowing in the wind. I'll be right back. Hold on one second. Give me 2 seconds. Whew. All right. That's better. Okay, cool. So the other thing to keep in mind, yikes. got water everywhere. Okay. Hey, tapping point. Okay. So the other thing to keep in mind as well is your bias. And so we have lots of bias. So we can have unconscious bias. We can have bias towards other people, people groups, all sorts of things. And so bias is something that we have to deconstruct and work on. And we deconstruct and work on that within ourselves, right? These again are inside jobs. So I recommend, that you have a healthcare provider. I have two, actually. I have two therapists or two people that I work with. One's more of like a life coach and the other's more of a traditional therapist, because I need somebody to go to as well that can hold that cup in that container for myself, so that then and can check me, right? And make sure that all of my checks and balances are in place. So I'm not projecting my biases onto other people. The other thing too is if I need to make sure that I'm 100% secure with whatever people group that I'm working with. So that may be, different people from different cultures or different genders or different backgrounds, experience. And so I need to make sure that I've cleared that at the door. So as a, for instance, right, as I deal with a lot of mental health work, I won't work with sexual offenders. That's just something I know for myself. I don't have the capacity to do that. I have a bias towards that. I have a judgment towards that. And so I refer those patients out to another professional that I think is better suited, et cetera. So those are some of those examples, right? So any of these biases that we have, either conscious or unconscious, we want to make sure we check those so that we are not doing more harm than good. And that's really what it's about. So that means you have to actually be self-aware. So emotional intelligence is really important as a provider. And that, again, is something that is lacking and missing in conventional medicine. I mean, the lack of communication, the lack of emotional intelligence, the lack of communication skills is deafening. And for me, I can't gaslight people, right? I mean, I have the capacity like we all do, but a patient's coming to me and they have a concern, they have issues, they have things going on. Who am I to tell them that what they have going on is not real or not founded or not realistic or whatever? And that can be really harmful for people when you practice in that kind of capacity. So we really want to make sure that, we're not projecting and we are deconstructing and we're working through our own personal awarenesses and our biases. Okay. So the other thing too is to have a support system. So if you are a healthcare provider, really important to have a support system, not just your family, not just your friends, but also other professionals that have similar experiences. Thank you. Thank you for my gift gone. Let me see. You know what? TikTok is being like super weird. Oh, here we go. Thank you, Solo. All right, cool. So making sure you have a quality support system of people for your personal life, but also too for your professional life as well. Thank you, Solo, to make sure that you are fully supported so that you can and then support other people. We talked a little bit about this, but I'll elaborate more. Emotional intelligence, I cannot stress this enough. Patients will trigger you, okay? They don't mean to, they don't intend to. You're human, they're human, things happen. But it's how you deal with those triggers. I think over the years in private practice, seeing so many patients really taught me how to work through my triggers, because patients would come in with all kinds of different assumptions and experiences and backgrounds and this and that and this and that. And, when you're working with people in terms of transforming their lives, you also are kind of tiptoeing around their ego a bit. So if they're triggered, they can trigger back, etc. So knowing how to, in the moment, self-soothe. I'll tell this little story. It was kind of anecdotal, but I had this guy that I treated many, many years ago. And, I go way over the top. Like, I give so much information. So when I do a blood work review, patients get a 45 plus page report with me. I go over everything. The initial consultation is an hour long. I go extensively through all their foundational health, et cetera. It's very comprehensive. So I had this patient come in. I book an hour for my initial consultation. Now, a person can choose to use that hour or not. So this gentleman came in, he, didn't have a lot to say, maybe about 20 minutes into the appointment. And I kind of kept like pulling things out of him. And eventually I was like, okay, well, I have enough information. Let's go ahead and do the labs. So then he had called back later and kind of felt ripped off, if you will, because he didn't get the whole hour. Now, mind you, he's not giving me anything. So we could have just sat there for a whole hour and stared at each other. But, if I'm asking you what your health concerns are, what your health history is, what you have going on, et cetera, if they're really short answers, if they're really succinct and you don't have anything more to say, what am I supposed to do? So anyway, he called back and he said, oh, he didn't get the full hour. So I called him on the phone, reassured him, spoke to him for another 45 minutes, explaining the process, going through all the things, whatever. And he was right. And so he was under this impression that with his $200 consultation fee, that he was going to get these thousands of dollars worth of testing in addition to. I said, no, it's just your consultation time, your labs and all of that are additional, et cetera. So anyway, we got through the labs. He did the labs. He came in for his review. I go over the full report, very thorough, very detailed, all the things. And at the very end of it, he pulled out one of my brochures, opened it up, and went through and said, see, I'm supposed to be getting all of these. And he would not let it go. And not only he wouldn't let it go. He insinuated that that I was ripping him off in some way. Now, mind you, I've always given more in use value than I receive in cash value. That's something I learned from The Science of Getting Rich with Wallace Wattles. And I always want people to walk away. Hey, Majesty, walk away with more and really gain a lot from their experience of working with me. So through all of that, right, I went way over the top. Remember, I did 20 minutes in the initial, 45 minutes post, 45 minutes with this big blood work review, et cetera. And then now he's still doubling down, letting me know, okay, labs. So I was so pissed off because instead of being grateful and actually responding to any of the information that I provided, he wanted to, in essence, call me, that I was trying to kind of rip him off, which I wasn't, but also then try to get more things out of me. Now that triggered me. I was really angry, but I can't express my anger. I mean, I can, but in a professional setting, it's not appropriate, right? So he knows what he doesn't know. It's clearly not a good fit. I'm not going to patty cake him or go over the top or prove my worth to him or any of those crazy things. So instead, I just calmly stood up. I walked him to the front. I said, okay, I took his report from him. I had the front desk refund his money. Bye-bye. Right. And so I then had to go into my office, right? I scribbled some things down about how I was feeling because I had to go right into another appointment with a patient who was highly religious and lots of indoctrination. And I knew I needed to be on my P's and Q's with her because she's going to listen to every single word and challenge every word and all the things. So I tell you that story so that you can understand that you are going to be triggered in healthcare. I have had many situations with patients and how they speak to me, how they treat me, etc. And as a professional, you want to hold on to your agency and you want to keep your grace about you and you want to ensure that you maintain your professionalism, even if, thank you for the army, even if your patient decides to not, right? So working on yourself emotionally, being able to be aware, being able to recognize your emotions. Yeah, I mean, for real, like I would say, first 5 years of practice was very triggering because patients would come in and just would say the craziest things to me, the craziest. And, I really had to learn that these people are coming because they're not well. right? And so I'm not going to assume that they're well because obviously they're coming for actual care, but I need to not take it personally. And that is a really hard lesson to learn, not to take it personally, especially if you're like me, which, I'm a very sensitive soul, and I have a really open heart and I love helping people. And so, users and people like that who are not there for your highest good pick that up and they can take advantage of you, especially if you don't have healthy boundaries. So having healthy boundaries is absolutely key just for yourself. Remember, boundaries are to help keep you safe so that you can hold space for your client. And that distance really helps with against transference, and against just, projection of people's stuff. Owning your own agency and owning your own space and knowing yourself and all of those things and doing your own work is really going to help, as time goes on. The next thing I want to go through is being a lifelong learner. So, I have 7 degrees in my field and hundreds of certifications. And the reason that I have attained all that is because I've been a lifelong learner. So I, started in massage therapy and I did that practice for a long time. And then I got into teaching, and then I got into nutrition, and then I got into, all sorts of things, right? And so as I kind of continued working, really how I got to the point of having all the education was me seeing what my patients were missing and seeing where my education was lacking. And so when I was working with patients and they would get stuck, like for instance, doing manual therapy, I worked with a lot of athletes like football players and golfers and basketball players and all kinds of professionals. And I did a lot of like really deep tissue manual therapy. But I noticed that a lot of these patients were treating me like a pill, meaning that they would come in, week after week after week, which was great, but they weren't necessarily, sticking with their programs or maintaining their nutrition or whatever. So that prompted me to go back to learn more about psychology and learn more about nutrition. And so again, I kind of worked with people, and then I get to a certain point where I go, okay, I need to learn this new skill or this new technique or this new something or other to be able to help me to be able to help my patients. You will never know everything and never learn everything. So you want to make sure that you stay curious and you stay open. Things in healthcare change so quickly. And so making sure that you stay abreast and apprised of everything's going on, especially right now in public health, which is kind of the umbrella that we fall under in a holistic practice. So as you are a learner and you're learning and you're growing and you're evolving, recognize the difference between if you have a career or a calling, right? So people are very drawn to this field and drawn to this profession. They romanticize it. Oh, you just play with herbs all day, whatever, whatever. And yeah, that may be on some level kind of what we do, but there is a lot of grit and work involved in this. And so if you're just doing it as a job, if you're just doing it to punch the clock, your patients are going to feel that. My patients know that I am all about holistic lifestyle. I'm super passionate about it. I love it. I live, eat, breathe the whole thing. My husband does too. Like our life is definitely very holistic, right? And so this is something that is ingrained in my DNA. It's something that I love to do and I'm passionate about doing it. If I treated this as a career where I just came in, punched a clock and left, again, my patient's going to pick that up because they may not be as excited about holistic medicine as I am. And so my excitement and my enthusiasm about the practice is actually contagious to other people. So just know that, again, this is not a traditional career. I will tell you, it's the road less traveled. Yes, we have a lot more acceptance, but it's really tricky because, we've got conventional doctors who are calling themselves natural doctors with no training. We have health influencers with no training. We have a lot of people who pretend like they can do this work, but they haven't actually done the work to be able to do this work. And so, and nothing against people that are not formally trained. I think, the way that we set this up is that, there kind of are three tiers. There are people who just want to do this work for themselves and their families. That's great. That's why we have the Holistic Lifestyle Community. There's a link in the bio if you want to join. It's totally free and we give free resources. So there's that aspect of it. But then there's also the aspect of, people that go into this profession and they're just looking at it for money, right? It's all about, catching a buck. And if that is your motivation and that is your intention, please do not go into this profession, because it's if money is your forefront, right, you are not going to be a good provider, right? And there are a lot of people out there that look at this as like it's a cash cow, and it's not. Yes, I've made a lot of money in holistic medicine, but I've also put in a lot of work. I've invested a lot in myself. I've invested a lot of time into studying, etc. And so what you put in is definitely what you are going to get out. Lots of people, like I said, are really drawn to holistic medicine, but don't understand that it is a job and there is a lot going on. It's very tedious, because you prep for your patient, you work with your patient, you send your post-patient, information. So it is very tedious. And so that's why we want to make sure that you price yourself appropriately, you value yourself, and you have those healthy boundaries to working with people that, you really want to work with, and not just people that you mildly tolerate, right? And so as you begin to develop yourself as a holistic provider, we want to look at the difference between identity versus technique, right? So anybody can give you a whole bunch of protocols, right? Anybody can tell you, okay, eat like this, take these supplements, take that supplements, whatever. But when you truly embody the identity of a holistic provider, a holistic healer, etc., it's not just the protocols that you're giving, it's literally who you be, right? And what do I mean by that? So patients just working with me in that healing container and in that healing space that we've created, they will benefit even if they don't necessarily take the supplements or change their diets. Why do they do that? And in fact, there's a lot of patients that, we spend a lot of time just talking, hey, touted kisses, and changing their mindset and working with their emotional health and helping them to deconstruct all of the things internally. And that happens way before we get into a supplement. So how can I help facilitate change and help people heal when I'm not giving them some sort of external thing? It's because, again, this is my identity. This is who I be, right? I'm not a shapeshifter. I don't change, from one to another, right? Who I am on social media is who I am out in the real world. And authenticity is very important to me. And being grounded and being centered and really being close to the land is also really important to me as well, because the more connected that I am to nature, the more connected that I am to creator and source and God, that way I can be that conduit and I can be that vessel, and my humanity is not getting involved, right? So if I'm thinking about my ego, my money, my this, my that, that's all my ego, right? But when I remove that and I push that to the side and I embody my role as a healer, as a provider, as a conduit, and as a teacher, now I'm embodying this identity of, that space of healing. So again, even being in my presence creates this sense of healing just because I'm embodying that identity. So think about that when we get into the actual course of holistic health coaching. We build your identity as a holistic provider. So we talk about your core values as a provider, your core values for your patients, and we really get into who you be as a holistic provider. Now, there are some qualities that are important if you want to be a holistic provider. So some of those are integrity. What you say and what you do has to be congruent, meaning they have to match, because you're working with patients, especially patients now with a lot of trauma. And so they are literally looking to be offended. I'm not just saying that, like a lot of patients, because of their ego, because of everything they've been through, they don't innately trust. And I don't expect that trust from the jump. And so I have to earn their trust. And how do I earn that trust? When I say and do what I say that I'm going to say and do. So if you have integrity issues, meaning you procrastinate, you don't follow up, you don't do what you say you're going to do, etc., you really have to work on that in order to be a successful provider, because otherwise, if you have lack of integrity, you're going to piss people off and you're going to harm people, and that's not going to work. The other thing is having compassion. Like I said, there's empathy and there's compassion, right? So compassion is, I can recognize what you have going on. Empathy is I feel what you're going on. So we don't want to feel what our patients are going through. We want to pull that back, having healthy boundaries with self. We want to keep that little sacred part of ourself with ourself. Instead, we want to observe our patients with compassion, because we truly don't want them to go through all the things that they're going through. However, we also recognize that this patient created this, right? So, and I know that can be controversial for some people, because what do you mean they created this? So based off of their thoughts, their actions, their, behaviors, their emotional health, their spiritual health, their environment, all of these things have accumulated and caused a dis-ease or an imbalance in their body in some way. And so really making sure that you as the provider, you are the conduit, but you make sure you put the onus and the responsibility on the patient, and having compassion as they work through the process of kind of uncovering, discovering, discarding, and healing. With that being said, humility is really important. And that's just so you don't get into your ego, right? So you don't get into this, I'm a provider, you're a patient, I know everything, you know nothing. You're actually collaborating, meaning you guys are working together as a team. And so you can't work together as a team if you've positioned yourself up here and you put the patient down there. And I think that working with me, I think that's been kind of confusing for patients, because patients often put their doctors on a pedestal. I don't belong up there. I don't want to be up there. And I'm not pretentious. I'm not inaccessible. I'm not, kiss the ring. I never wanted to be that type of doctor. I never wanted to create that type of environment. I actually loathe pretentious doctors. I've worked with them all the time. I don't like them, because they're difficult to be around. They're not real individuals. I go to seminars and workshops, and I'm an innovator. So I'm going to think outside the box. I'm going to, challenge old ideas and old thinking. So, I'm being myself in these, seminars, and challenging this idea and challenging that idea. And what do you think about that? And of course, they're looking at me, with their nose up going, Dr. Steele, well, why would you do that? And why would you recommend that? And very like, falutin. And then I'd be like, okay, I'll be at the bar, so, I recognize that a lot of times doctors are not approachable. They also can be very smug, be very arrogant. And when I built my family practice in Virginia, I wanted to bring back that old school family doctor that knew you knew your family, knew everybody. And so now closing my physical practice, taking it online, taking it virtual, being able to work with far more people all around the world, and recognizing that we have real gaps in our providership. We need more providers, and more providers that are trained, especially because our current public health system is collapsing, and it's not going to ever go back to the way it was. I know people want it to, but not so. With that being said, you do have to have a lot of courage to be a holistic provider, because you are literally working against a system that does not want to see you successful. The system is doing exactly as the system was designed. The system is a diagnose and manage model. It was designed to diagnose your sickness and your illness, and then manage that using a pharmaceutical, a surgery, or procedure if one is available. And so that diagnose and manage model is the current state of the system. So the system is not about healing. It's not about transforming people's lives. It's not about empowering patients. It's not about collaboration. It's none of those things. And so we have to have the courage to speak truth to power. We have to have the courage to be able to stand up and say, this is not right, this is why, etc. And again, as a holistic provider, working with medical doctors, working with conventional doctors, when I moved initially to Virginia, so I had my practice in Virginia for 15 years. I crash landed from California. When I went there, it was like the medical community freaked out. They were like, who is this lady? What is she going to be telling our patients, etc. So I really had to earn, right, that trust and earn that ability. And I did it with putting my nose down and focusing on my patients and getting the results, right? Because, okay, you can think I'm a quack and woo-woo and all this other stuff, but am I getting results for my patients, right? And so the results were undeniable. And so, yeah, oh my gosh, yes, so many smug elite docs, like I'm over it. So when patients are seeing, or excuse me, providers are seeing, wow, this patient's glucose was at a 140 and now it's at an 80, 85. What are you doing? Oh wow, you're working with that provider, keep it up, keep it doing. And so then eventually the providers went from being very fearful of me and looking at me as like an adversary or some quack or whatever, to going, oh wow, this practitioner is really helping my patients get well. And it was undeniable. So then they started to actually refer patients to me. And again, I built my practice through referrals. So patient referrals, provider referrals, et cetera. And doing a lot of public health education, setting up tables, getting out there, talking to people, and just making the message of holistic medicine known. And so that's how I built my reputation, is just by showing up, doing the work, and literally sharing my soul with people. So a lot of courage, especially when you're the only one in the room talking about natural health, natural medicine, getting well, et cetera. It can be really kind of demoralizing, I would say, at times, especially when you've got so many people challenging you all the time. Are you a real doctor? I mean, like on every TikTok live I go on, are you a real doctor? Like, what kind of doctor? Oh, you're a fake doctor. You're not a real doctor. So you kind of have to have a little bit of a thick skin to be in this profession, and not take it personally, because it's just their ignorance. Like they don't really know. So just keep that in mind. Having patience with people is really important. And so, hey, Candy Girl. So I actually have 7 degrees in my field. I have an AS in psychology. I have a BS in natural healthcare sciences, a BS in alternative medicine, 1 doctorate degree in natural medicine, 1 doctorate degree in naturopathy. I'm a board certified naturopathic doctor, so I had to go through board certification process. I have a master's in public health and an MBA, so a master's in business administration. So, and then hundreds of certifications like in functional medicine, integrative medicine, clinical hypnotherapy, neurolinguistic programming, family constellation, all these other things. So, oh, thank you so much. So again, having, I think at one point it was about making sure that, oh, I'm not sure, I'm behind for this path. Oh, thank you so much. So you're not behind, not at all. I always like to say I went to school so you don't have to. Breaking things down for you in very simple terms, making sure you understand, the clinical practice of it. I did not have as many mentors like in the field, because there just weren't that many, honestly. And there definitely weren't people that look like me. Let me tell you, not at all. And our profession, unfortunately, is very mixed. So we have medical doctors, we have osteopaths, we have nurses, we have all different types of conventional professionals. And unfortunately, a lot of those conventional providers don't go through any formal training. And that has been my biggest pet peeve, because there is an art to this work and there's a science. So you can't assume, oh, I'm just going to, give a patient a supplement instead of an herb. You have to actually really understand how the body works. So when I was working with Dr. Virginia in Northern Virginia, she has a school, and she would train conventional providers, and the gaps in their education is significant. They're not trained in the subtlety of the body. They're really trained more in the big stuff, the diagnose, the disease, the management, that sort of thing. They're not really trained in how the body actually functions to be able to support the body's ability to heal itself. And then integrating the mind, the body, the spirit, all that stuff, forget forget about it. It's not there. So having patience with yourself as you go through the process and the journey of educating yourself, having patience with providers who are ignorant and not aware of what you're doing, having patience with patients who think all you do is give people a whole bunch of herbs or whatever, and not understanding that actually that's a very small percentage of what we do is giving people supplements and herbs. It's really working with patients on their mindset, working with patients on their emotional health, working on patients on their decision making, working with patients on their habits, their lifestyle, working with patients on their environment, and cleaning things up. I'll work with a patient that'll come in, let's say with a thyroid condition as a for instance, and we'll be working, and then several years go by, and then we uncover, oh, they're in a toxic marriage. And so the reason they have their thyroid issue is because they're not communicating their truth or speaking their truth, right? But it's taken all that time to build that rapport and build that trust to even get them to open up and to allow me to be able to help them. So I say all that to say that having proper integrity, compassion, humility, courage, and of course, patience are core qualities of being a holistic provider. Definitely. Yes, exactly. Not being able to speak your truth, speak up. A lot of thyroid conditions originate from those communication issues. Okay, so as a holistic provider, I think that all holistic providers are leaders in their own right, but leadership is really important in a holistic health profession. Why? Because you're modeling, matching, and mirroring. So again, when I was in family practice, and I was like in super family practice, so I would treat everybody. So babies, kiddos, mom, and my practice was built where it was like a house, and it felt like a home, and there was like fireplaces and couches, and I did not want a doctor's office, like a boring, sterile doctor's office. So instead, I made it like a house. It was very homey. There was lots of toys. We had this train table that kids used to love and play with, whatever. And when I would notice, like especially with mom coming in, I remember this one patient in particular, she had 3 boys, and these boys, they were all like kind of 7, 8, 9, that in that area, and they would run her ragged. And the moment they would hit the door, they would just go crazy, right? And I'm sure that they were crazy outside, but I only have a certain period of time with them. So in being a leader, right, I'm seeing all of this. She's exhausted. They don't have boundaries. They're all over the place. So me stepping in, again, self-care is leadership, going, okay, right? You guys may not have boundaries out here, but in this office, we are going to have boundaries. So what I would do is I would work with mom, right, by modeling and matching behavior with her children. So I'm standing there going, no, you're not going to speak to your mother like that. Otherwise you're not going to be able to play with the train table set. And literally, I would have to kind of embody their mom for a moment, and so it's just so mom could get a break, but also too, I could match and model that behavior for mom so she could see what it looked like to be able to kind of raggle roost these 3 boys, right? And so over time, there's a lot of compassion, there's a lot of empathy, understanding, et cetera, and all of that, because I know she's working off whatever tools she's got, and 3 boys right there in a row, and then her husband was in the military, so she was primarily a single mom, even though she was married and all of that. And so me just matching and mirroring and showing her how to operate with these 3, boys was really key. So make sure you understand that as soon as they hit the door, right, that's when your care begins. It's not just when they're sitting in front of you and you're working with their water, their food, all that kind of stuff, but it's also showing them how to create a lifestyle that's going to be more conducive for them. So, I did that a lot and worked with lots of families, even with married people. I'm working with husband, I'm working with wife, and then I'm working with husband and wife together. I've saved a few marriages with that, which has been really cool. Even just getting people ready to get pregnant, and what it takes for their bodies, their minds, their spirits, all that stuff to go through that process of bringing in new life. And so those were incredible cases as well. And working patients through their own decision making. So for instance, there was one patient in particular, she was my patient for a long time. and she wanted to get pregnant, and we tried everything, and it just wasn't working. So we sent her for an assessment, but with an OBGYN, because she was having a lot of pain in her pelvis. And so we wanted to rule out fibroids and all that kind of stuff. And so we found that there was a blockage of sorts. And so there was like a specialized surgeon that she had to go to, et cetera. And that surgeon assessed her and said, the way that things are looking, it's probably recommended that we do a hysterectomy. And so she was like, okay, she accepted it. She wanted to have babies, but she kind of accepted that this was going to be, her truth. And again, my job is not to step in and tell her no, or this or that. My job is to look at all the facts, give her proper informed consent, and let her know what her options are. So anywho, so we're working through the process. So she had to do her pre-op. So she goes in for her pre-op, and boom, she's pregnant. Right. And so she calls me and she's like, oh my God, I did my pre-op. I'm pregnant. They told me to go home and kind of think about it because, she's about to do a procedure to remove everything. Right. And so they're like, well, we don't know. There may be risks, et cetera. And again, I'm holding space for her, being compassionate, being empathetic, all the things, right? Weighed it all out with her and her husband. She decided to keep the baby. She ended up delivering, no problem. She didn't have any issues. That baby, I think now is like 5 or 6. Total miracle baby, right? Total miracle baby. And so again, like, I want to share that because your role is to kind of lead people through sometimes some of the most difficult things in their lives, having children. Right. Exactly. Yeah. And hysterectomies, in the conventional medical model, it's either birth control or hysterectomies. And with the canceling of DEI studies, I really don't see that improving anytime soon, unfortunately. So conventional medicine is very behind. If you're not aware, women were not included in studies until the late 90s. So we are really behind when it comes to studying women's health and women's health issues. And don't even get me started on Black people in general and our health issues. Almost non-existent when it comes to studies. Our representation is very, very small, which is also why I got into the work that I got into as well, because we are very unique people and we have a whole set of, things that we need that, are different from our counterparts. So having this leadership, make sure that you're modeling these healthcare practices, make sure that you're a living example. Doesn't mean you have to be perfect, doesn't mean you have to be, get all the things done, but definitely on your journey so that you can also speak intimately about, how the process is and what things you go through. I can speak more intimately about it because, again, I've lived it. This is something that I do and something that I practice. This is not just a job, right? It's a calling. So want to make sure that your, daily health habits are non-negotiable, your food, your water, all of those things. We've talked about this a little bit, but I just want to make sure I take it home. Boundaries, 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 right? Having a safe space for yourself, holding that self-care space, making sure you carve out your time for your lunch, making sure you're eating every few hours, making sure you're hydrating, making sure you're working on your own emotional health, your mental health, your spiritual health. All of those things is really key, and keeping your junk on your side of the street, right? Even if a patient comes at you crazy, learning that you are the professional and you being the leader and just going, okay, I've been cussed out more times than I can even count, because again, I have healthy boundaries. So I'm not going to allow a patient to just talk to me like ever, but also too, I'm not going to allow patients to be stuck in their sickness, right? I'm going to challenge it. I'm going to push it, right? And remember, the ego's job is to keep them safe, and it's a defense mechanism. So as soon as you trigger that and you don't want to agree with the ego, right? What happens? People react. They go into fight, flight, freeze, or fawn. And so understanding those reactions, understanding how to maneuver in those reactions to keep yourself safe, but also to keep your patient safe. There is something called transference and countertransference. Experience this a lot. And so meaning that there is a level of familiarity, and because you're in a relationship with your patient, it can sometimes the boundaries can be blurred. So it's really important to keep those boundaries intact. So some of the most common transferences that I've experienced are, patients projecting like their mother onto me, like, or any kind of anger, hostility they have towards women, that has shown up. Or on the reverse side, men and women both, hitting on me as well. So thinking that it's more of a relationship than it is. That is a common transference. And then there's also counter transference as well. So that is you projecting your stuff on the patient. So again, you want to keep your stuff on this side of the street and keep your stuff all locked up so that you are not doing any kind of counter transference with your patient or projecting any sort of unhealthy or disease with that. And so it's a slippery slope because you're balancing so much as a holistic provider. You're listening to what they're saying, you're reviewing the data, but you're also reading energy at the end of the day as well. And so when you're reading energy and you're reading, where they're stuck at, and you're pushing on that, again, you're going to trigger patients. So understanding how to manage those triggers by keeping both of you guys safe. The last thing in terms of boundaries and emotional intelligence, that I want to speak to you about, is having resilience. So making sure that you are meditating, being mindful, and also tending to your nervous system. So remember, our nervous systems, we cannot heal in a state of fight or flight. We can only heal in a state of rest and digest, which means we want to create an environment for ourselves that our nervous systems feel safe, feel healthy, feel supported, so that we can then hold space for other people. The other thing is cultural intelligence and reverence. So again, with my public health degree, we learn all about different cultures and how different cultures respond and react and really engage with their health. And so I've treated people from all over the world, all different religions, all different backgrounds, all different experiences, etc. And so this is where I have humility, right? And cultural humility, where I put my own thoughts to the side, my own spiritual beliefs, my own emotional, all that stuff to the side, and I'm open. And because of that, I've learned so many things about so many different, cultures and religions and backgrounds and that kind of thing. Because my role is not to come in and fix somebody or make somebody different, and also to be respectful. So in the South, a lot of times people were Christian. I'm not Christian. And so they would come and they would ask, are you Christian? I say no, but I respect Christianity. And I actually would have elders that I would call that were high up in the in Christianity, in their churches and that kind of thing, that if I had a question that I needed to answer for a patient and using some sort of biblical reference, that I had a resource that I could call. So even though I'm not necessarily that, I can be open and work with people from all different backgrounds, et cetera. Now, if a patient is looking specifically for a Christian provider, that ain't me, babe. So I then would refer them over to somebody else. So making sure that I check in with those things, those are very important for people. Making sure, culturally, there's also a lot of people like Jehovah's Witness, for instance, they don't do blood transfusions, that sort of thing, or Seventh-day Adventist. They don't typically eat meat. They're vegetarians. So, those sorts of things. Hebrew Israelites, very high patriarchal environment. So if I'm working with husband and wife, right, husband is usually in the room with the wife, doesn't let the wife kind of have her own space. And so even though I'm like, blink twice if you need help, I make sure, that I'm respectful to whatever they decide, as long as, of course, there's no abuses and things like that that's going on. Because it's their choice, right? It's their choice to do whatever they want to do. There are a lot of religions where they don't believe in like birth control or using any kind of protection. Like if you're married, it's kind of like a free for all, and it's been a balance because the woman wasn't healthy enough to carry a baby, but then the husband has his own set of needs. And so trying to kind of balance that and trying to help them all understand that for your health, right, we need to make sure that we're looking at this holistically and not just looking. So it's a very delicate balance, right? Because again, these are people's beliefs, and not that I want to take their beliefs away. And whatever you believe is great. Do your thing. However, I have to make sure that I maintain my professionalism and advise them. I can't omit that information just because I know that they're not going to want to hear it. I have to present that information to them in a loving and respectful way. And then I give them the opportunity to make that decision, whatever that works for them. So, if they want to do it, great. If they don't want to do it, great. Ultimately, it is their choice, their decision. I'd love to say that everybody listens to me, but they don't. And so I gave up on that a long time ago. And also, it's not my responsibility. So I let go of that savior complex. My responsibility begins and ends once the information leaves my mouth. So I'm there to look at the data, evaluate the data, give that patient that information. If they take it, great. If they don't take it, that's on them, unfortunately. And I've had many patients come back to me after a couple years go, oh my gosh, I should have listened to you. This is what happened. This is what happened. And I don't do the I told you so. That's just not my style, because I recognize that people have to go through what they have to go through, right? That's having compassion. That's having understanding, but it's also having healthy boundaries for myself and for them. I'm not Operation Save a Hoe. That's not my role. So continuing on, we're talking about that lifelong learning and professional growth. So we're always evolving as providers, and we're always learning new things. I've learned so much from being around different providers, or even just people calling me. I remember, I was trained in Hatha yoga and Iyengar yoga initially, and I did some work with Ashtanga yoga, etc. And then one day I had a friend call me and say, hey, there's a guy in town from LA. He's doing a Kundalini training. I thought about you. What do you think? And so I go, yeah, sure. Right. It was presented to me on the journey. My first time ever doing Kundalini yoga literally was my first day of teacher training. Oh my gosh, incredible. And so, and it was an amazing transformation that I would never have found on my own. So it's really cool. Once you get into this field, you'll find that you just become a magnet, and people will bring things to you, and you'll learn from different people. I've learned from, different types of doctors. I've learned from chiropractors and medical doctors and osteopathic doctors and PhDs, but I've also learned from, the holistic healers and, the self-taught people and the Reiki, healers and all different people. I mean, I can learn from anybody. And so being in this field, it's really cool because you get so much exposure to so many different things. Really, the world is pretty open. And so making sure that you are committed to a growth mindset and staying, open to growing, open to healing. You'll break down, break through a million times, but as long as you keep getting back up, that's the key. And so lastly, with lifelong learning and professional growth, it's having balance. So again, right, you're balancing what you know, what you learned, and then what you need to learn. And so making sure that you have that balance for yourself so you're not burning yourself out, because, there's definitely a lot that you can learn and go through in this profession. So making sure, again, you're taking care of yourself. All right, so we're going to wrap up the current state of our public healthcare system. So if you are unaware, right now we have RFK Jr., who is at the helm of Health and Human Services. He is an environmental lawyer with no background or education or experience in public health or public health policy. He is backed and funded by a lot of health grifters. And why I call these people grifters, and some of these people were my colleagues who before this situation I would have said I respected. But unfortunately, I've lost a lot of respect for a lot of different providers simply because the motivation has been about money. And then the secondary motivation has been about helping people. And so I also can't kind of co-sign thank you so much for the heart me, co-sign administration that on one end is, removing healthcare access for millions of people and deregulating corporations for environmental issues. Because when they are deregulating these corporations, what is happening is that they're allowing for these corporations to dump toxins in the environment. Look at Elon Musk in Tennessee, right? That town in Tennessee now, it has lots more respiratory health issues, a lot more mental health issues, a lot more physical health, metabolic health issues. And so I can't co-sign, my brain doesn't work like that, with integrity, right? And so we have a pretty dangerous public health system right now. There's concepts of a plan, there's no specific plan, and there's also a lack of experience. And with public health, you want to have people that have training, have experience, and have a plan. Public health is all about being ready, right? So being able to prevent things. It's not reactive like conventional medicine where you're kind of doing things on the fly. And there's some planning, but in public health, we really try to make sure that we have everything that we need ahead of time, whether that is educating the general public, whether that is making sure that we're giving patients preventative strategies. Like, we know that cough, cold, flu season is right around the corner. So in about September timeframe, like the end of August, around this time, and September, I'm going to talk all about health and building your immune system before the weather drops and people's immune systems start to go nutty. So there's a lot of nuance that we learn in practice. So not having that proper healthcare experience, the law is different from healthcare and medicine in general. So not having that healthcare background is really, again, very, very dangerous. Also, to recognize that our current health state is not driven by acute illness. So most of the unalivings and all of that stuff don't happen because of pandemics, endemics, and bugs and things like that. They actually happen because of chronic disease, which is driven by modifiable lifestyle factors. These are things that patients can control. But because there is a lack of public health education, meaning direct education to the public, right, and quality education. So now we have this mass amount of education, but we also have a lot of confusion going on, right? Because again, what generally can work, right? Eating fruits and vegetables is the key to good health, and drinking water and rest and all that kind of stuff. There are some situations where a patient may not be able to digest those fruits and vegetables because there's something going on with their system. Or, that patient may not be able to drink as much water because their kidneys, are troubled, or what have you. And so we take the information from a general perspective, and then we want to individualize that and give patients those individual tools so that it's more attainable and accessible to them. And so that's a lot of the reasons why our chronic disease rates are at an all-time high, because of access issues, because of not having proper health information, and also because people don't trust the healthcare system because it's very predatory. If a patient goes in and they decline a treatment, sometimes they can be coerced, bullied, kicked out of the practice, or even worse. And so we have a very adversarial healthcare system. And so it prevents people from engaging with it because they just don't like it. It's not safe. It's not supportive. It's not healthy, etc. There's also a shortage of providers and burnout of providers. When I first got out of school, the ACA was just starting. That was pretty crazy, that rollout. Health insurance went all over the place. That's when I decided to get out of the healthcare insurance billing and become a concierge provider, which is pretty innovative at the time. And wanting to make sure too that I'm managing my time well. So again, I don't get burnout because I'm one human, right? And so for many, many years, I worked 18-hour days, 6-7 days a week, serving patients in and out, in and out, in and out, until one day I just couldn't do it anymore. And I decided, you know what? I think my skills and my abilities are elsewhere. So really know when it's time to take a step back, take a break, or do something different. Like I mentioned, there's lots of gaps in our access, especially in rural and underserved areas. Yes, exactly. Yes, a lot of doctors have left the insurance-based model and gone into concierge model simply because the insurance really it holds us a lot. Like we have to jump through so many hoops with the insurance companies to justify and rationalize treatment, even just simple lab testing. So really at the end of it, I found that I was spending more time doing all that administrative work and less time actually giving patients the care that they need. So it really didn't make sense for me, which is why I moved out of the system. Plus fighting the insurance companies to pay us, that's a whole nother thing. So we really need to focus on prevention and holistic education, but quality, non-general, but very specific information for different patient groups. So qualified healthcare providers are also very much of a shortage. And what do I mean by qualified? Providers that are actually educated, that have gone to school for the craft that they are doing. They didn't just go to their medical school and now they're hanging their shingle as a holistic provider just because they think that it's easy. It's not an easy profession. There's a lot of nuance. You're treating patients physically, environmentally, mentally, emotionally, spiritually, and ancestrally. So you're working with patients on all of those levels, from a subjective, which is what the patient tells us, and objective, which is a data lab, something we can measure. So to be able to do that, you need a lot of understanding and ability, but also you need to have proper training. So I know we live in the world of the influencer, and nobody wants to. Exactly. I know there's so many different things with medicine that I would change for sure. But we do still have a shortage of practitioners, quality trained practitioners. We also have a lot of new practitioners getting into the field. And while we learn a lot in school, I know I learned more of my work actually working with patients. So quick story, when I first got out, I was so scared. And I've told this before, I was so scared of harming people. Like after every appointment, I would go to my books and look everything up and take notes and make sure that I told them the right thing or whatever. And eventually I realized, it was probably about after 4 years, I realized none of my patients fit in these books, not one. And so I ended up having to push my books aside, and I actually started to listen to my patients. So even if it didn't make sense, even if I didn't know what the cause was, I took them at face value. I believed them, right? And my practice became very much like a refuge for people that had been injured by the healthcare system, that had been gaslit by the medical system, that had been ignored by the healthcare system. And so I started to take on a lot of patients and get a lot of referrals, even from providers who just didn't know what to do with their patients. Their patients kept coming in. And they're like, you know what? We don't know what needs to happen, but why don't I send you to this lady? If she doesn't know, we don't know, right? But and I built my career on working on those difficult cases, those really challenging people that other providers weren't necessarily getting success with. And it taught me a lot about myself, taught me a lot about healing and helping. And then you start to see patterns and pattern recognition. So there is a balance between the science and the holistic art, the practice that we talk about. And so we always use the science to help guide us. We always use the science to be able to keep that as scientific order and that structure. However, we also want to balance our intuition, right? And you go through a period of time as a provider where you don't trust yourself, right? So you've got all this knowledge, you've got all this training, but then you also have this intuition that's coming up, and you're kind of conflicted about the book versus the intuition, right? I say do both, right? Have your structure to keep the patient safe and keep you safe, but listen to that. Every time I've listened to that, it's never steered me wrong. Even if my mind is like, I'm hearing things, I'm seeing things, I'm feeling things, and my mind's like, that doesn't make sense. And I'll say it anyway, right? And I'll say it anyway to the patient, and the patient will be like, oh my God, how did you know that? Right? And so how do I know that? Because we're in communion with each other. We're in a mignon with each other. So we're balancing our energies with each other, and we're collaborating, which is a beautiful experience. And so, breaking through those barriers of learning how to trust yourself, learning how to maximize your intuition, learning how to, be this healer that you want to be. It takes a lot of work. I really remember I've gone through several practices, but I used to have this really big practice that had like a hydrotherapy room. And I remember sitting in my hydrotherapy room really grappling with trusting myself, because I had, again, all this book knowledge that I was trying to sift and sort through, but I also had a lot of this intuition about how things would go. And I had to learn how to balance the two worlds, right? So definitely learning how to balance your intuition along with your physical health, your mental health, your emotional health is key. The other thing I'm going to talk about is misinformation. So there is rampant misinformation all over the internet. So there is a difference between a health influencer and a health provider. So health influencers are not necessarily the enemy, but they can spread a lot of misinformation. A lot of times their goal is to sell products, to sell services, etc. And so, and a lot of times they don't have that depth of medical education. And so making sure, that you are respectful, but also calling out, again, misinformation. So health influencers tend to build more awareness to the field. They create more accessibility. And they really start to break down those health conversations. However, there is a lot, again, like I said, a lot of misinformation, a lot of oversimplification. It drives me nuts when I see this. I saw somebody the other day post like 3 steps to transforming your ancestral trauma. And I was like, oh my God, somebody come and get me, So, and sometimes, for the most part, I say 85% of the time when I see these things, I will call it out in a nice, in a respectful, in a professional way, but making sure that my voice is heard, to make sure that, hey guys, healing ancestral trauma is more than 3 steps. Okay. I just want to put that out there, more than 3 steps, because a lot of times they're trying to sell a program or a course or whatever. Not that people won't get benefit out of it. I'm not saying that, but we want to be realistic with patients. It takes a hell of a lot more than 3 steps. If it were 3 steps to heal our ancestral trauma, we would not be where we are today with everything. So also too, just want to kind of send this home. Health influencers tend to, again, not have education, or they may have very minimal education. Their thing is to kind of sell products, sell services, etc. Oh, thank you. Whereas a healthcare provider, we go through that rigor, we go through that education, we go through that structure in that therapeutic order. And so that's why I really focused on teaching you guys all about therapeutic order, because I've seen so many health influencers even present that they're healthcare providers. When we check their education, they're not. And you can really tell because there's no therapeutic order. Notice I taught you all the therapeutic order and taught you, it was a lot. We learned a lot, but I taught you those things to make sure that you understand them. And so now you'll take them and start working with them and all of that. Very dangerous. Yes. And ancestral trauma and healing ancestral trauma, again, very delicate work. And it's typically some of the last. Like, we work on the physical, the environmental, the mental, the emotional, the spiritual before we get to the ancestral work. And how I came to that conclusion, go ahead. Yeah, you can ask your question. How I came to that conclusion was through doing the work, right? And being shown, by my ancestors, the system and the processes, etc., and just organizing them in a really efficient way. So definitely start off with a lot of education and experience, and then working with people through a process, and then listening, learning how to trust myself. So go ahead and ask a question, Hidden Gem. Let me know if you want to come up and ask the question, or you can ask it in the chat. What panel do I need if I have swelling in my right foot? Okay. So for swelling, so swelling can come from your blood. It can also come from your kidneys and filtration, right? So what I would recommend is a CMP 14, which is your kidney liver function, a CBC with differential, which is your expanded immune system, your TSH, which is anterior pituitary to thyroid, just to see how that's working, your lipid panel, which is your fats pretty much, but also it recognizes how your liver is functioning because toxins will bind into your fats. Homocysteine, which is your body's ability to detoxify itself, which is important if you can't clear those things. B6, B12, folate, and mag. Now, if you don't remember all that, it's totally fine. Shoot me a DM afterwards. I'll send it to you. And so I want to also make sure that you understand. Yeah, exactly. So I will repeat that, Oceans. So a CMP 14, which that's your kidney liver. So comprehensive metabolic panel, that's your kidney and liver function. Then we have your CBC with differential. So your CBC with differential, you have your basic CBC and then you have your with differential. With differential is going to show you your expanded immune system. So it's going to show you if there's parasites, viruses, bacteria, etc., right? Your lipid, which is how your liver is functioning, homocysteine, B6, B12, folate, and mag. So those are nutrients, but they're also helpful in methylation pathways, which is going to be more on a genetic level. So the conventional doctors also too are trained to diagnose and manage disease. So they're looking for a disease. So they're gonna look, obviously check if there's edema, pitted edema, etc. Yep, homocysteine, B6, B12, folate, and mag. So you're only missing the so it's B6 and B12, folate, and mag, but all the other ones you got it. And then homocysteine is spelled Cysteine. So conventional doctors are trained, again, to diagnose and manage, not to prevent, reverse, or stabilize. Exactly, you got it. And magnesium, yeah, you got it. Cool. So they're going to look at your labs. So don't be disappointed if you run the labs and they say everything's normal or everything's fine, right? Don't feel betrayed, right? Because their role is to diagnose a disease. So if it comes back and everything's normal, all that means is what you have going on is subclinical, below what can be diagnosed, which means your body is on its way to developing a disease, meaning the function of your body is breaking down. And so we look at the metabolic system to be able to help heal. So with any kind of swelling, things like that, we look at obviously blood flow, kidney, but we also look at your pH balance, right? So we look at making sure your mouth is alkaline, making sure you have enough stomach acid. Think minerals. Think hydration, half your body weight in ounces in water, because it's a filtering issue. You're having difficulty filtering things. So start pumping the water, right? And getting some minerals. Those two things alone are not going to harm you in any way. You don't need a doctor to tell you to do that, although, there you go. And so those are ways, again, that you can be more proactive instead of reactive. So if you need any further information about your labs, etc., feel free to join our community. It's totally free. You can ask questions. I can shoot some resources in there for you. I have tons. I mean, we're talking 20 years of PDF documents and this and that, and, all sorts of research that I'm working on, compiling and organizing. That's why I haven't been as online as lately, because I've been trying to get things organized in a way that makes it appealing. So you're so welcome. So I love education. I love teaching, as you can tell. But I also believe in quality training. I believe in people to actually get the training that they need before they go help other people. Naturally, if you're learning to treat yourself, that's a little bit different. You can learn a little bit, etc. But if you are intending to be a holistic health practitioner, this is why I did Intro to Holistic Medicine 1 and 2 together, and did it from a good foundation. That way, as you go into your course, if you decide to, go forward after these courses with me into holistic health coaching, you have a strong foundation to work from and to be able to build from. And so education, again, super important to me, that you understand what needs to be done and how, and all of the things that can go wrong, because there's a lot that can go wrong. And so bringing comprehensive education is really important to me, making sure that everyone gets all of the information they need at whatever place that they're at. If you were just a mom wanting to help your kiddos, or you have a condition going on, or you want to be able to help change the world and help change the face of natural health care and public health. So our institute, so I have in the yes, so the year-long program, I will be sending out an information. It's around $5,000 for the year, but I am obviously doing some promotions for those people that just signed up, and we will be working through. So I'll be sending some emails out. I'm going to take a few weeks off and just kind of get our last classes and worked kind of all organized and set up. There are also payment plans available and all of that. So I'm going to get our last courses kind of wrapped up, make sure everything's right where it needs to be, and then I'll be sending information out, etc. With the so all right, let me break this down for you. Chapter of Grace. Okay, first things first, there's a difference between alternative medicine and holistic medicine. So alternative medicine is like what you're saying. So you're saying, oh, I'm taking gabapentin. What's a natural thing that I can take that mimics gabapentin? That actually isn't holistic practice, right? So that's conventional practice kind of dressed up as natural practice. So what we want to look at is number one, what's the gabapentin treating? So usually it's like nerve pain and stuff like that. So then we want to look at why the patient is developing nerve pain, right? And so it's not just the diagnosis. So let's say a patient has fibromyalgia, right? Which is why they're having nerve pain, which is why they're on gabapentin, right? So again, we backtrack it. So why they're on gabapentin? Because of the nerve pain. Why are they having the nerve pain? Because of fibromyalgia. Why do they have fibromyalgia? Because they have breakdown in nutrients and overloads of toxins. That's all fibromyalgia is. We call it a trash can diagnosis because of the high toxic load. So a lot of times when a patient is put on gabapentin to help block that stuff, a lot of it is toxicity, specifically heavy metals within the system. So what I would say initially, hydration, half your body weight in ounces in water, making sure that you're eating your quality proteins, your lean proteins. So that would be in order from top to bottom of your lean proteins: chicken breast, turkey breast, white fish, making sure you're getting your adequate amounts of protein that you need every day and breaking that down so your body has enough energy to repair, and then minerals. If you're having a lot of like nerve pain and things like that, there are things like infrared dry sauna, which can help to reduce that. There's also, we used an ionic foot detox as well, which was very helpful when we would have like diabetic patients that would have a lot of neuropathy in their feet and their legs. That would be really helpful as well. So hopefully that answers a little bit for you. There's also anti-inflammatories as well that you would want to consider. So like your curcumoids, etc. When we're looking at minerals, we're thinking magnesium, number one, because the soils are depleted in that. But we're also considering other things like your phosphorus, like your chloride, those sorts of minerals as well, your potassium. So a lot of times you can get a trace elements, which kind of has a lot of those minerals, boron and things like that already built in. So I would just get a multi-mineral and then kind of go from there. In terms of magnesium, as you know, there's different types of magnesiums. I would say like a glycinate could be helpful. A citrate's going to go right to your bowels, whereas a thionate's going to go to the blood-brain barrier. So I would say a glycinate, although a triple mag a lot of times will cover you. Triple mag, it has about 3 different magnesiums in it. So it'll have like a glycinate, citrate, and maybe a thionate in it. It'll have 3 different magnesiums in it, just so you're not getting hyperdosed on one specific magnesium. So I would choose just like a multi-mineral though. Trace Elements is a great brand. They're a blue brand. They are a retail brand, and they have like liquid or they have capsules. And I would just start taking lots of minerals, quite honestly. Triple mag. So Vital Nutrients has a great triple mag product. Vital Nutrients is the brand. I'm not sure if you can get it retail. If you can't, I have a dispensary and I can send it to you. So triple mag, which is 3 types of magnesiums. Usually it'll be like citrate, malate, and maybe glycinate together. Or sometimes they'll do like glycinate and citrate and thionate together, whatever. But a triple mag. I use Vital Nutrients, triple mag. I like that. Yes, Celtic sea salt can be really helpful too, especially because it has about those 86 cations and anions in it as well. And so all you have to do is take a little bit of that sea salt, dip it in your water, just a little bit of pinch, and drink that. That can be really helpful. And you can make your own electrolytes using Celtic salts as well. Trace elements. Minerals. So trace elements, and it's like a multi-mineral. You can look for something like that. Blue Bottle, and then Vital Nutrients Triple Mag. Yeah, definitely. And then especially if you're having, so why are you taking the gabapentin? I just assumed it was because of the nerve pain. But please let me know if you're taking it for an off-label reason. Sometimes, so there's like standard reasons why you would be prescribed gabapentin, and then they use off-label reasons. So I just want to confirm that you're being prescribed it for specific for your nerve pain. So if you can clarify that in the comments, then I can give you a little bit more specific. Yeah, that triple mag, the Vital Nutrients Triple Mag, anybody can take it, quite honestly, no contraindications on that. And minerals, again, are not contraindicated because our body needs minerals, and they need minerals bad. So typically minerals are pretty safe. I don't have to run labs or anything like that. Hydration, half your body weight in ounces in water, and then your triple mag and a trace minerals would be really helpful. So just let me know. Yes, got it. Okay. So the back injury and herniated disc, that actually, have you looked into any lasers and laser therapies for that? There are certain traction with laser treatments that they can do to help with herniated discs, and to help with that. And naturally, with a back injury, you're going to really want to work on your core and building your core strength. So building up your pelvic floor and building up your abs, really important to support your low back structure, because otherwise, if your core is weak, that low back is weak, it's not going to be supported. So making sure that your core is nice and strong and supported, doing a little bit of physical therapy on that. Cold therapy on the back as well to help reduce that inflammation. I would definitely throw some curcumin in there as well. Castor oil packs can be helpful too. So that's just applying the castor oil because it has omegas in it. That can really help with inflammation, and then with a little bit of heat to absorb it into the system. So yeah, so hopefully, that would be helpful for you. So core, strengthen that core. Castor oil on the back, ice too. So 20-minute ice, 20-minute heat. If you don't want to sit with the ice, you can do like a peppermint essential oil, a eucalyptus essential oil, just with a little bit of base oil, rub it on there, and that helps. Try to stay away from like your Tiger Balms or your other like petroleum based products like that, even though they feel good, because the petroleum's so thick, the viscosity doesn't absorb, so it doesn't actually penetrate through the system. So it's better just to use those essential oils directly, like camphor, menthol, eucalyptus, peppermint, directly on that region. The other thing too is kinesiotaping as well. So while you're trying to strengthen your core, also doing some kinesiotaping on the back, just to help build that structure and that stability of your low back. And definitely you may want to look at some decompression and laser, cold laser. Usually chiropractors will do decompression and cold laser. There's like a huge machine that operates it. So hopefully that helps. And that can kind of keep you out of the, hopefully the nerve pain situation. There's not a lot other than what I mentioned that can be done for herniated disc. You just have to really support that region, that area. The other thing too is being mindful, because gabapentin, although it's helping with managing some of the symptoms, it can overwork your liver quite a bit, because gabapentin's kind of a nasty drug. I'm not sure if you saw if you've seen all of the inserts with that, but that one is not one that, in my opinion, you should be on one long term. So definitely watch your liver with that. You're very, very welcome. So hopefully that can help, with everything. And yes, it's not a good medication to be on long term. It's a very nasty medication. And I don't say that about all of them, quite frankly, but that one is no good. So definitely castor oil pack on the back to help with the inflammation, kinesio taping as well on your back to help with the support, core support, and then supplementally minerals, protein. Protein helps your body to repair and heal, and then also curcumin in turmeric. So those can really help. Oh, yay. Yes. Well, because of all of the synthetic aspect of it, and it wreaks havoc on your liver. So that's also why magnesium is so important, because if you have COMT, which is a genetic variant, a lot of times you'll be magnesium deficient, and that can leave you more susceptible to things like dementia and Alzheimer's and things of that regard. So just being mindful with all that jazz. All right. So we've talked about leadership. So seeing yourself as a part of a larger movement, part of, the future of healthcare as a provider. And so forward thinking, I know sometimes it can be very demoralizing, but we want to advocate for ourselves and we want to advocate for other people to ensure that they have, a healthy healthcare system regardless of what they're going through. The last things I want to kind of leave you with are provider embodiment reflections. So asking yourself, yay, for sure. Definitely. Please give us a follow. And I do go live. I'll be going live more regularly once I get my life back together. So some of the questions to ask yourself, who do I have to be in order to deliver a plan with excellence? Like, what do I have to clean up in my life in order to execute these things? How do my personal values align with my clinical decision-making? And how do I create safe, empowered, and partnership for my patients? So remember, you're not up here, your patients are not down here. You guys are collaborating and you're working together as a team. So how do you create that safe space and how do you embody that? If you need feedback on your templates, so again, this week I'll be kind of finishing up until this week, all of your videos and replays and all of that are in the course shell. The only thing that's not in there is some of your handouts. So that will be my next task, is going through and getting all your handouts and getting your case studies in there. So if you haven't started your case study, don't stress. It's okay. I haven't even gotten the information in there. So I wanted to make sure I got all of your replays in there. That way you could look them up. So this replay will also put this in there later today as well. So this will be in your course shell along with the PDFs for the slides and whatnot. So if you want any feedback, feel free to reach out to me in your course shell. I'm pretty accessible, so DM me, or in the community, in your community, send me a message there. So the last thing I want to go over with you is vision casting. And so that's seeing yourself, what type of provider you want to be. Do you want to be a compassionate provider? Do you want to be a, supportive provider? Oh, you are so welcome. What kind of provider do you want to be? Do you want to show up? For me, I wanted to bring back that old school family doctor. I wanted to, and I did it. I mean, really, like, I've treated thousands of families, and it's been really, really amazing because I've been able to watch patients through, being single, getting married, having babies, sending babies off, parents aging out, all divorces, all sorts of different life experiences. And so that's why I loved family practice so much, because I got to work with babies that weren't even born yet, that were just coming into this world, all the way to elderly, and working with patients on end of life and end of life care. I've just had an amazing career. And again, wanting to share that. And I know that if I don't share what I know, it will unfortunately die with me. So making sure that, people have the information, legacy, even if I'm not around, even once I'm gone. So that's really where I'm at in my life, is building this legacy, building all of these big platforms, and putting all of the education that I have and experience into all of this. So I will also put a guided visualization in there for you as well for this week, so that you have a guided visualization, so that you can begin to go into the inquiry of who you are and who you be as a provider. So definitely look for that. Tomorrow I will be teaching another class. So because I didn't teach on Wednesday, I'll be teaching Saturday. And then tomorrow I'll be teaching at 1 o'clock tomorrow versus 11. And tomorrow we're going to talk about the role of a patient in holistic healing. So today we spoke about the role of the provider. Tomorrow we'll talk about the role of a patient and who you need to be as a patient, and what you're looking for, the characteristics that you're looking for in patients, because there's a lot of different patients and people that are looking for care, but being able to evaluate if they're actually ready for care, or if you just want to send them some information and then reach out. I am a big proponent of giving lots of information. As if you can't tell, I give out lots of information to really build myself as that authority figure. And it has worked year after year after year, because people will have saw me teach a class, years ago, or been to my practice or whatever, and they'll remember me, right? And then, something happens in their life and they'll reach out to me, or they'll refer a patient to me or whatever. So making sure, again, you're that authority, you're singing the praises and sharing with people. That's what's going to help you build your practice faster. So tomorrow, we're going to talk about healing as a partnership mindset. So shifting from that quick fix mindset into more of a long-term transformation mindset. We're going to talk about the key patient qualities that are needed, what it requires to be your own health advocate in terms of your tracking, et cetera, and building trust, especially in the healthcare system. So this is the last week of our Intro to Holistic Medicine 2. I have 2 classes that I've taught, actually more than that, but this is a series. So we have Intro to Holistic Medicine 1, which goes over all about your nutrient deficiencies and accumulated toxins, and then Intro to Holistic Medicine 2, which is all about detoxification. And so that's what we've been really working on. Again, we look at it from subjective and objective. So we look at it from, how we can measure these things, and that way we make sure we're getting results for our patients. So these are 2 classes that are prerequisites for our holistic health coaching certification. And so I'll be sending information out to everybody. So definitely join the link in my bio if you want to learn more information. Join our communities as well. I'm going to be reaching out individually to the students who are enrolled in this class, and make sure they're doing well and they're ready to kind of finish up their last project. Again, if you're not necessarily ready to jump into a course, totally fine. I do have our holistic lifestyle community. There's a link in the bio where you can gain access. And now that we're kind of closing out this class, I'll be able to put more resources in there. I've got tons of new resources that I'm super excited about sharing and giving away. So we'll be doing that, but also too some low cost, some free, some mid-range, that kind of thing. There's something for everybody. The community is kind of the first place that people are going to hear it. I'll be getting my calendar organized. No, you're totally fine. You're totally fine. And so we'll be getting all of this stuff organized and structured, etc. Ocean, definitely reach out to me. Maybe we'll do a one-on-one, and that way I can kind of help you kind of get your life together. So feel free. For my students, I do give complimentary appointments where we can just kind of chitty chat and go from there, just so make sure you get through this process. And so in the community, I'll be putting out any future classes, any trainings. I'm just going to kind of do more webinar style trainings, probably for now until around September. And then in September, October is when we'll be launching our holistic health coaching program. So getting lots of information out there. Also too, once you join the community, you will have access to our Holistic Life app, where you can track all of your data. You can track your water, your pH, your sleep, all of that things. Oh, no, you're totally good. Yeah, you're good. And so we also have lots of courses. So I've designed so many different courses. It's all part of the learning experience. It's all good. So all kinds of courses and collaboratives, things like that. And you get to stay connected. Also with the app, if you have a question, a healthcare question, you can send me a message and say, hey, what's up? I've got this going on, that going on, etc. Also my open office hours, that sort of thing. So definitely look at joining that if you have time. So, all right, before I jump off, I'm like sweating like, I don't even know. I'm sweating like I live in the Caribbean. And so before I jump off, does anybody have any questions for me? Let me check on the IG. Nothing going on the IG right now. Nothing going on the YouTube. Anybody have any questions on the TikTok? Otherwise, I'm going to log off. I will be going live with Solo Salsa. We will be debating probably some race-related topic and talking about probably reparations or God only knows what. So definitely hit the bell if you are on TikTok because I go live with him as well as my own lives as well. So definitely check us out. And let me see if you guys have any questions before I log off. I'll wait around. All right. Well, I'm going to log off onto the YouTube. See you guys later, and the Facebook and all of the things. So goodbye. All right, cool.